just like any other health system, we have a bunch of physicians that just have a huge desire to try new technology and new products all the time. And we just didn't have a great process to control that, the inflow of all those requests, and to really see if there's any efficacy to the things that they were requesting. So as we identified the problem, we knew that we needed some help, probably from a physician, because the messages that we needed to send were probably best sent by a physician. And so we were able to work with Dr. David Skarda, who's a pediatric general surgeon, and he has a real passion for eliminating waste and really diving into some of the evidence-based questions that should be asked as we're bringing in some of these new products that need to be used in the operating room. Dr. Skarda stepped in and helped us create a pathway, or really define a great process for engaging physicians on certain aspects of value around evidence-based medicine and peer-reviewed literature, and really questioning the motives of bringing product in, and what problem are we trying to solve, and can we actually stand behind some evidence as we brought those products in. So what we did is we defined a process top to bottom on how physicians could engage with the supply chain and try out new things to make sure that we're always at the cutting edge of technology. The outcomes have been great, because as we've engaged with Dr. Skarda and Dr. Skarda has engaged his peers, it's changed the dynamics of the conversation. Typically, the supply chain was the one saying no, and we always were questioned because clearly we were not clinicians. So when Dr. Skarda came in and started having the conversations and started going through the why and the how, the response from his peers were much better received, and they could understand why we were doing what we were doing, and just adding the credibility of a physician to the supply chain really changed the dynamics of how we operate, purely because the responses from the physicians were much more understanding rather than adversarial, which is something that anyone can benefit from. We were looking to take out some premium bone grafts, and our primary payer reached out to Dr. Skarda and said, hey, why are so many of these being used? We don't see any evidence of better outcomes. And as Dr. Skarda talked to some of the users, the physicians, they agreed that the literature wasn't there, and we just, honestly, with a few clicks of a button, we were able to take $250,000 to spend out of our system and move that to less expensive bone grafts. And ultimately lower costs to the patient. One of the great things is we actually had Intelare help us with some of the process design, and we hired one of the consultant branches, and they came and they stepped in and they sort of say, what if you do this, what if you do that? And they were able to give a lot of great guidance just because they've done this, I think, other places. And that experience was invaluable as we were outlining the process and the various steps. So we had a lot of great help from some of the Intelare folks in putting together the process and the documentation of what we're doing at Intermountain Healthcare.